Welcome back from the break. I'm Uday Pratap Singh. You're joining us on NewsX. Our big focus this hour. The US has approved the PFIZER biotech COVID vaccine late Friday, paving the way for millions of vulnerable people to receive their shots in the world's hardest hit country. President Donald Trump immediately released a video on Twitter where he hailed the news as a medical miracle and said the first immunizations would take place in less than 24 hours. It comes as infections across America soar as never before, with a grim milestone of 300,000 confirmed deaths fast approaching. The US is now the sixth country to approve the two-dose regimen after Britain, Bahrain, Canada, Saudi Arabia and Mexico. Meanwhile, COVID vaccination blueprint is ready in India as well, and preparations are taking place. COVID vaccine storage facilities are being set up in parts of India. Training is being given on how the process will commence. Airlines are also ready for the distribution plan. Joining us to look at this story further is Dr. Sampath Shivangi, member National Advisory Council at US Health and Human Services. We also have Dr. Harish Gupta, member Central Council of Health and Family Welfare, Government of India, joining us live. Dr. D.K. Gupta, CMD Felix Hospital, is live with us. Dr. Manmohan Agarwal of Max Hospital is also joining us live. Dr. D.K. Gupta, why don't you come in, if you're able to hear me now, on
Yes,
of course, PFIZER's approval in the US and also the timelines in India. We are hearing that even as we wait for the approval, the cold storage facilities are now getting geared up. The distribution plan is being put in place. Airlines are being readied as well. So India gearing up for the vaccine approval.
Yeah, I think next week will be very crucial for approval, and we are looking forward to get approval as soon as possible. Probably we will get in next week. And I think both the vaccine manufacturer, Pfizer and AstraZeneca, through Serum Institute of India, they have applied to Director General, Drug Director General of India also. And it is in process. I think they have raised some query also, and they have submitted. And most probably we will get approval in next coming week only. And vaccination process will start from January onwards. That is definite, because every country is in very pressure, every government is in pressure, and they are looking forward to vaccinate their population so that this pandemic can be curtailed. And one thing more, the government is very visionary, and they are doing very great job right now. They have collected all the data. Data sourcing has been done from different districts, from headquarters, from hospitals, clinics, polyclinics, even frontline warriors. They have collected and they have segregated data also. And the guidelines to the headquarters have been issued by the central government and respective state governments for data sourcing, data segregation, and how to storage of vaccines. Even the warehouses has been made in districts, and how to collect vaccine from airport to their warehouses, from warehouses to clinics, hospitals, and from the clinic hospitals, what is the guidelines for the inoculations also, they are all had done, and they have been, training has been started in these places also. So I think that this month will be crucial for everything, and the coming year will be happy and healthy year for whole world, including India.
Thank you so much for
Dr. D.K. Gupta. Dr. D.K. Gupta wants to come in.
Yeah, I think I will like to add one thing, like after 2 doses also, we have to wait at least for 4 weeks for development of full immunity. 3 to 4 weeks are required for development of full immunity. Even after second dose, we have to wait for 3rd month. Means if you got first dose in the month of January, then you will be immune only after completion of March. So that's the most important thing. And after giving one vaccine also, we are not sure that it's giving 100% immunity. So there are chances still. And one thing more, like this vaccine can prevent disease. Till now, we don't have knowledge that this vaccine will prevent carriers also. Means they will prevent the transmission of infection also. Like there are vaccines which are preventing, like BCG vaccine that prevents only tuberculosis disease, but they don't prevent the carrier stage. The patient, if he is infected, they can transmit to others also. But for these vaccines also, we have to wait that these vaccines only preventing the disease only, or they are preventing both carrier stage and the disease also. If they are preventing both the stage, then we should remove the mask after 6 months or 5 months after having the herd immunity, or maybe after immunization process is completed. But if they are not preventing the carrier stage, then for few more months we have to use all the precautions like social distancing, mask and hand hygiene. That's my point.